Give us just a moment. I'm just getting the recording going in case anybody wants to watch this later. There you go, Mary Ann. Sorry about that.
You know, I do this, I teach in these classrooms all the time, and I always have someone helping me. Always have to have a backup person with me to make sure I'm recording. So our target population, and this really is the target population for the entire program. We'll repeat this a couple times just to make sure that we're all on the same page, but we're really looking at all potential CalFresh eligible populations in the far north state and throughout the state, including individuals and families with children under the age of 18, high-need college students, older adults, and households with language access barriers. Now, I know some of you are from our far north partners, and some of you are from our college campus partners. And so as we go along, just kind of know that not all of this information, right, some of this information is going to pertain to specifically to far north people, and some is going to pertain specifically to college campuses. And so we are, oh, there we go. Okay, so I want to talk about the far north a little bit first to see what you can expect from us, and as we're going along, right? We're going to look at the far north subcontractors, the campus subcontractors, talk a little bit more about the geographic area, and then the deliverables and outcomes of KPI number 1. So when we're thinking about methodology and timelines, these really, for implementation, these really are things that go hand in hand. And much of this stuff is ongoing, that we're kind of constantly doing this analysis as we receive reports, even daily, weekly, and monthly. But some of it is going to be on an annual basis. And so we don't expect you by any means to be reporting to this, reporting every aspect of this all the time. These are just kind of the map of where we're going to be going with this data collection. And so we're going to be looking at process data as probably the thing that's the priority for the far north community subcontractors is the process data collection, where we're going to be looking at pre-screens, application submission data, and approval numbers. And that's just an ongoing process that we have. We want to be making sure that we are monitoring, just our basic day-to-day operations in this program. To make sure that our outreach is being consistent and being persistent also across the region. We're also going to be doing monthly in-house master log participant tracking, and that means that we're going to be, when the master logs come into CHC, we're going to be just tracking this as we go along. You've already, all those people in the far north community should have already submitted some master logs to get that tracking. I know I've seen at least one of them recently, and so a compilation of them. And so I know that you've all been doing that, and you're probably pretty familiar with that basic master log participant tracking. Then we're also going to be looking at monthly caseloads, expedited services, how many people go through expedited services, enrollment relationships with social services, with other social services, and then as available and as needed, we're going to be looking at the Code for America getcalfresh.org database just to monitor their participation rates and their application rates, and then the CDSS CalFresh data dashboard as needed. And then we're going to also be working in-house here at Chico State with our GeoPlace mapping lab. It's a fantastic program that's going to help us with mapping and kind of having a visual representation of where services are provided, but also where we might need services and where we can target for new populations to be accessed. And so we're going to be doing that through, we're working with students, which as I'm a professor here at Chico State, and so this is actually a really fantastic aspect of this program, is that we're going to be working with students in the GeoPlace mapping lab to produce printed and digital maps, interactive and online story maps, and web apps for uploading and sharing information widely. Our goal is to let all of our subcontractors see where their participants are and being able to more effectively do outreach because of this geo mapping that we're going to be doing. And then we also have a few different areas of how we're going to be collecting data. And again, this is going to be ongoing and then also on an annual basis. We've got some frequency data that we're going to be doing, and this is very similar to the Far North subcontractors, but this is for campus subcontractors where we're going to be looking at baseline and quarterly data. We're tracking, reviewing, analyzing at each contract year, and again at the end of each quarter. We're going to be asking you for those logs, and then we're going to be compiling that information to make sure that we have our participation. And then we're also going to be looking at the data dashboard, the California Higher Ed data dashboard, to identify sites where the highest concentration of potential non-participating eligible students reside or frequently visit. And so we're going to be using both data that we rely for you upon, right? We won't be able to have that data, particularly with the frequency data, without your assistance. And then we're also going to be looking outside to the California Higher Ed dashboard for information to access participants. And then probably the biggest source of data in the long term for this program on the effectiveness of CalFresh is the annual reporting that we're going to do. We're going to be doing a lot of quantitative and qualitative data to look at the impact of CalFresh participation on student success. And so we'll probably talk about this a little bit more at a later time when we're just looking at campus participants for campus subcontractors. But just to give you a heads up that we will be beginning next spring. We're going to be doing more quantitative data collection. But at first, we're going to start off with the baseline with the master log, follow up on tracking records, self-reported surveys, which is the annual survey, and then also CalFresh participant interview data. So we're going to be doing this at the beginning of contract year, collected, analyzed, and compared to the annual results at the beginning of the year. So this is essentially longitudinal data that we're going to be looking at to try to assess, what is the impact when students participate compared to when they don't participate in CalFresh, and what does that do for their grades, for their sleeping habits, for their academic success overall? Does it impact things like how much they have to work? We're actually in a pilot study of this right now here on our campus, and we're going to be looking at some data pretty soon with this. And so this is a big aspect of this, because this is the basis of where we're going to be able to disseminate a lot of information to the public that might help us continue this program in the long term. And so the quantitative coupled with the qualitative data is going to be very important, and I'll follow up with that in just a couple minutes. We also have the master log follow-up tracking records that will be collected quarterly on each campus, and then again, the self-reported surveys or CalFresh participant interview data. So we'll be doing widespread surveys. The surveys were having targets of 10 to 15,000 participants each year, and then we'll do smaller cohorts of interview data after that. Naomi, do you have anything to add at this point?
I don't, but let me just pull up the chat box really quick. And if anybody maybe has any questions, feel free to either put them in the chat box or unmute your line. We're more than happy to answer any questions. But it looks pretty quiet in the chat box. And we'll have more time at the end too. So if anything does come up, feel free to send it our way.
Yes. Absolutely.
Oh, here's a question. Just making sure the slides will be made available. Yes, we will have the slides and this recording available on our website.
Excellent. So as I mentioned before, we're going to have geomapping. The geomapping laboratory data will be available for us to use, and that is really going to be important when we do you know, when we're trying to analyze what pockets of people are we missing, this is a, you know, we put a visual analysis on this type of data, we just get a broader sense of what's really happening. And so we're going to be looking at things with this geodata, things like the highest concentration of potentially non-participating eligible people, where they reside, where they frequently visit, and then try to figure out how to reach those people. We're going to be looking at and we'll be analyzing that in-house with our CHC team, and then probably reaching out to our subcontractors as well periodically, because you all know your regions much better than we do, and so we will be, you know, collaborating with Chico State's Geomapping Lab and also with you, just to kind of figure out what really is happening on the ground. And so, again, we'll be disseminating those in printed form, digital form, interactive, online story maps.
And Marianne, it looks like there is a question. Maybe before we move to the next slide, would you mind just chiming in and adding a little clarification on the difference between qualitative and quantitative data?
Melissa, you're speaking my language now. So qualitative data is data that we use when we talk to people or when we observe people in doing their normal everyday thing. Qualitative data is about very in-depth, trying to find in-depth interviews and discussions with people, trying to find out things that we might not have known before. We really do qualitative data when we're talking about, you know, you can put a bunch of questions on a survey, but sometimes we don't know all of the possible answers. And so we'll go back around and we'll do interviews with people, or we'll observe people to see what their habits are that they might not even be aware of. So qualitative data is all about talking to people and getting just a more in-depth, but also a more you can't really generalize with qualitative data, but you get very in-depth information from qualitative data. So think of things like if I sat down with you and asked you, so how was your day today? And you just kind of talked about, right, everything for 10 minutes, that would be qualitative data. Quantitative data is all about the numbers. And so we do essentially closed-ended surveys, meaning that we'll ask you a question and then you have a choice of answers that you cannot deviate from. And so that's really great to see the trends in large groups of people. You know, when we're talking about 10,000 participants for our annual impact study, we want to know, right, how that has changed, how participation in CalFresh has changed things like GPA, and or how many hours someone works. And so we give you a specific option to answer with that. And so it's quantitative, it's about quantity, right, of how many of something. And then we look at that, as a sociologist, we look at that for the trends in that data. Does that answer your question, Melissa? Hopefully.
Great question, Melissa. Thank you for asking that.
Sorry, as I forget that people don't know that. It's what I do, so I forget sometimes. Anyway, so thank you for the question. And then, so right, like I said, we're going to use this geomapping, and then we're going to look at very specific things. When we're looking at the campus, we're going to be looking at, sorry, I got sidetracked by the question. Now I got to get back to my slide. So when we're looking at the far north community subcontractor sites, we're going to be looking at, right, in addition to the far north community site locations, right, we can say, okay, this is your location, we know that this is underserved. We're also going to be looking at surrounding sites where we can identify where the highest concentration of potential non-participating eligible residents and their families might be. So we're gonna go out to, we're gonna try to identify places like homeless shelters, stores, schools, and health centers where people, you know, might congregate, but and might be eligible, but aren't necessarily participating in the program at this point. When we're looking at campus subcontractor sites, again, we're going to be really looking at those sites where people go that they might be seeking out resources, but they haven't signed up for CalFresh, and so they might be eligible, but they're just not signed up yet. So, when we have students come into food pantries and we see a pattern where they're coming in quite frequently, that food pantry is a great emergency resource, but if we can also identify that they might need long-term resources, that would be a great thing as well. So food pantries, low-income housing, child care facilities, especially low-income child care facilities, student services offices, veterans offices, financial aid offices, health centers, etc. Right? So we're looking at very specific places, right? Where might these people be? How do we locate them through geomapping? So this is these are our outcomes. These are the things that we have to produce to satisfy the contract. In the far north processes, we are looking at frequency data for CalFresh pre-screens. So kind of keep these things in mind. When you're going about your day, okay, what do I need to make sure that the team at CHC knows, so that way we can answer the questions that the state might have, right, in order to continue this program. So things like frequency data for CalFresh pre-screens, application submission, and approval numbers. Incredibly important to be tracking that and to be, and to be, thinking about how is this going to be used. I promise we look at this stuff, and I promise we report it to other people, and they make decisions based on this information. And then also geomapping laboratory data. And then for data outcomes, we're looking at the results, right, that we're going to be for two different purposes. Number one, we're going to be analyzing what programmatic activities might be needed, but then also we need to be reporting back to the state. We're going to be using all results from CalFresh data dashboard and geomaps to show our progress and to talk about what programmatic activities are needed. And then for our campuses, we're looking at frequency data again for CalFresh pre-screens, application submission and approval numbers. We're looking at the data dashboard for student data and the geomapping laboratory data. And then we're going to look at that again to strengthen our programmatic activities as needed. And then we're going to be disseminating that information in printed maps, digital maps, and the interactive and online story maps for our subcontractors, but also for others who might be interested. And then campus impact. This is probably, when we're thinking about, especially for all you campus people who are trying to figure out, right, how is this really impacting your students? This is going to be the most important thing, because we're going to be looking at, this quantitative and qualitative data on impact. The reasons for application denial, barriers associated with the application and enrollment, and impact of CalFresh benefits on student success. And so we're going to be, again, looking at our programmatic needs, and then our team, this is my charge for the next couple years. Our team is going to be documenting and disseminating this information. We need to have this information in order to continue the program, and so we're documenting the impact of CalFresh benefits on student success, graduation, and long-term employability. So documenting and disseminating for all of you campus people. And then from you, we're expecting that each subcontractor is going to provide a mid-year narrative and an annual report on site data and geocoding efforts. And then we're going to summarize that process and impact data for all Far North and college campus subcontractors and disseminate that annually. Any questions about KPI number 1? Okay, I'm going to hand it over to Elisa, and she's going to talk to you about the rest of the KPIs.
I just click?
Yeah.
Technical difficulties here.
Good morning, everyone. This is Elisa. So I will be talking about KPI 2 through 4. So we will begin with direct service. And I bring back the target populations again because this is a very important topic. As you may have noticed, we report on the contact sheet, or we collect that data in the contact sheet and then enter that into the master log. This data does go to CDSS quarterly. They do look at our target population, so it is very important that we do collect this data and report it properly in the master log. So direct service, our prime contractor activities, which is us as a prime contractor holder, is to offer training. So we do face-to-face trainings offered annually to each subcontractor. We also do further in-depth remote trainings as needed, and webinars provided quarterly or on an as-needed basis. We also provide technical assistance, which is phone communication on demand, group conference calls, and monthly newsletter. And Erin, to answer your question, KPI stands for Key Performance Indicators.
Great question, Erin. Thank you for asking.
So plan for CalFresh application submitted. And again, I will do what Marianne did. I'll talk about the Far North and then campuses, and we separated those out. They do have different plans, so we will just bear with us. So the Far North provide application assistance currently at family resource centers, child care programs, community colleges, food distribution sites, and at community outreach events. And then for college campuses, CFO, student staff, interns, and staff will receive comprehensive training on CalFresh outreach. Also, the campuses establish a drop-in assist date and hours and make the drop-in assist day and hours consistent throughout the semester. Coordinate a campus-wide CalFresh outreach day, which many of you have already done, and then table at campus events as well. So CFO activities and implementation for both the Far North and campuses. After applications are submitted, CFO staff input data into the master log. Then they provide the follow-up multiple times throughout the 30-day process via text, phone call, or email to confirm the status of the application. We also provide assistance with verifications by allowing our applicants to come in and do copying, faxing, or other assistance, whether it's uploading it to the portal or any other assistance that they may need. And then we track semi-annual reports and annual recertifications using our tracking log, and then that gets entered into the master log. So we do report on semi-annual reports and annual recertification quarterly as well. So any questions with KPI number 2? It is very straightforward. It is what we are currently doing as a contract as a whole. Okay, we will move on to KPI number 3, which is partnerships. CHC, CFO Prime, and Far North teams will target high-need potential CalFresh eligible residents in addition to SNAP-Ed partnership by collaborating with health and medical clinics, school, local district food services, child care sites, our Women, Infants, and Children program, which is a WIC program, food banks, local farmers markets, and other adult services like our North State Benefit Enrollment Center. And with our college campuses, they will collaborate with CSU, CCA, and of the Chancellor's Office and the UC Office of the President, with accelerated associated organizations, with academic departments such as sociology, nutrition, public health, student services offices, and as well as other state-funded programs that increase employability that we often talk about, which are listed in the back of the pre-screen, and additional programs as well. And then methodology for our Far North partners. So CFO Far North teams will coordinate with existing resources center programs and services to promote CFO by tabling with partners at community events, such as health fairs, children's fairs, any events that are in the community. They will distribution of materials, so our drop-in assist flyers, or that we offer application assistance. They will provide presentations to key partners. They will attend community or county meetings to share updates, ask CFO-related questions, share best practices, and discuss any barriers that are happening in the community. And then for our campus partnerships, our campus will establish CFO drop-in hours. They will do tabling events on campus. They will do classroom presentations, presentations to faculty and staff as well, application workshops, so where you're able to do multiple applications at once by offering a workshop. We do have a faculty referral form, so if you are interested in receiving that form, please let us know. The program manager can share that with you. And also, we encourage that you attend basic meetings, AS meetings, and graduation initiative meetings. The scope of work metrics. So partnerships are we do collect those quarterly from you. They are in the pre-screen and partnership tab. And then in the mid-year and annual narrative, you are able to provide more detail of your partnerships, and we would love to hear that. We do report that back to CDSS. Any questions with key performance indicator number 3? Okay, we will move on to KPI number 4, which is disaster CalFresh. So CHC, CFO, and Fort North subcontractors are able to provide disaster CalFresh assistance to any Fort North county. So in the past, we have provided assistance to multiple counties in the Far North, with either us being on site or just distributing information. Campus subcontractors can provide disaster CalFresh assistance to their high-need students on their campus sites. So if it's a county that has been given this disaster CalFresh eligibility, you can say they are able to provide services to their students on site. CHC, CFO, and subcontractors are able to share any related information with disaster CalFresh. And CDSS identifies the geographic areas of the timelines and the timelines for disaster CalFresh. So it is being guided by CDSS. And this is something that we do not guide ourselves, but we do help out when needed. Great. Any questions for any of the KPIs?
Well, we will go ahead and leave the chat box open for a little while, and if anybody has any questions, feel free to unmute your lines. One thing I would just like to add before we really wrap up here is that you probably are likely noticing that we're talking about evaluation a lot more this year than we previously ever have. And that is mostly because this is the first year that CDSS has really had a focus on this and allowed for some of these activities to even happen. So it's really exciting for us that we're able to do some of these things now, and we really look forward to sharing more with you as we move along. So thank you both, Marianne and Elisa, and thank you for all of those who joined us. And we have a little bit of time, like I said, so we'll leave the webinar going and opened if you want to stay on and ask any questions. Otherwise, have a good rest of your Friday.
Naomi, real quick, this will be available on YouTube soon, so you can share this with people, or you can just rewatch it to get more information, and we will provide those slides for you as soon as possible. Thanks everyone so much for your participation.
This is Stephanie. Can you guys hear me?
Yes.
Hi everyone, good morning. This is Stephanie Bianco. I just wanted to reiterate some of the things that Naomi mentioned about how new all of this is. And I do recognize there was a lot of information that was just given to you. And we will be breaking all of that down too, just so that you can see a little bit more clearly what is expected. I think we did a great job of giving us an overview of the key performance indicators. Sometimes people call that scope of work as well, like the work that we're doing regarding research. But I just wanted to remind everyone that everything we're doing is really to get our low-income residents and students signed up for CalFresh. And when we're looking at all of this data, we do need to remember that that's our primary focus. And so that anything that may impact getting the final enrollment from the county, that is so critical to share with everyone. So even if it isn't something that is a required piece of data that you need to send, if there's anything that will impact this work or getting someone signed up, please document that as well. It can be, as it was mentioned, qualitative or even anecdotal data that you hear from someone That also is really important, and I just wanted to stress that and thank the evaluation team for providing this training to everyone. So thank you.
Yeah, thank you for that reminder, Stephanie. And I think that's all our team has to add. So have a good day if you're taking off, or we're here for your questions.
Thank you, everyone.